If we recall what we have been doing in colorectal cancer, this was one of the first tumors where we were able to stratify part of the treatment because we gained the knowledge of the epidermal growth factor receptor and how important were the mutations in the pathway. The predictive value of KRAS was made apparent. Also, we are working on other mutations like BRAF, NRAS, PI3K, and some others. So we are quite deep enough targeting the epidermal growth factor receptor.
We learned also that not all KRAS wild-type tumors are equal, and within the KRAS wild-type tumor, only a subgroup, maybe half of them, are really EGFR dependent in their growth, and so the EGFR inhibitors will work well. So what we are doing for a true personalization of medicine in clinical and translational research efforts is to define which are the other molecular markers that together with the KRAS status will help us to better define those individuals in which the tumor is truly EGFR dependent, in which the EGFR inhibition is relevant for cancer cure.
What it's going to be in the future is that we are going to have some tools that are being developed very intensively, I would say, that are going to help us to differentiate between all colorectal cancers, which are the tumor types that are going to be more dependent on one particular pathway or on the other. I think that we are in a transition process of being clinically oriented to a position where we are not only clinical but molecularly oriented in the characteristics of the disease.
The more we do the molecular characterizations of the tumor, the more we learn that these pathways are very relevant, and within these pathways we can define the different subgroup of tumors, and hopefully in the very, very, very near future we can define which are the best molecular target therapies and strategies for each subgroup.
It's very clear that unless we understand the biology of the disease, how the disease is dependent on particular alterations that we also know that are not going to be fixed over time in the evolution of the disease. So we have also to think on the plasticity and evolution of the disease. If we don't recall on these aspects, there will be no way to make major advances in the outcome and the overall survival of patients.